be our ay, Ayan, sorry for that. Okay, so to continue, before we begin, meron bang gusto mag-start ng prayer? Does anyone want to lead the prayer before we start? Will you do this in other classes? Sige. Who would like to lead the prayer for this afternoon, for our class this afternoon? Who would like to volunteer? Okay, can I request Dr. Tricia Peñaranda to lead the prayer for our class this afternoon? Are you there? Tricia? Trisha, hello? Sige. Sino na lang instead of Trisha? Si Coretana Yani.
Hello po, Doc.
Hi, can you lead the prayer?
Okay po, Doc.
Okay, thank you.
So let us bow our heads and feel the presence of the Lord. So let us pray. O gracious, loving, merciful Heavenly Father, we thank you for this day. Thank you, O Lord, for the opportunity that we can learn from Dr. Malibago about pediatrics, especially about adolescents. Lord, I pray that you bless our internet connection so that we won't get disconnected. I pray, O Lord, that you give us wisdom and knowledge to understand Dr. Malibago's lecture. I pray, O Lord, that you help us to focus so that we will become the doctors that you want us to be. Help us to learn more about medicine. In Jesus' name I pray. Amen.
Amen. The Father, the Son, and the Holy Spirit. Amen. Thank you, Liani. How do I call you? Liani?
Yani po, Doc.
Yani,
Silent L.
okay. Okay, sige. Thank you,
Doc.
Yani, for that
You're
beautiful
welcome po, Doc.
prayer. Okay, so good afternoon, everybody. Have you had your snacks? Nag-snacks na ka mo? Or nag-nap ka ba ka mo? Okay. Or you have a class before this?
We had a class po, Doc.
Okay. Sige. May break naman, no? So, okay lang
Opo.
Okay, sige. So, good afternoon again. I will not be asking your names na kasi Madam mukha mo 109. So, I'm Dr. Jam, Dr. Malibago. And for this afternoon, this will be our continuation for our lecture last October 26. So, last month, I introduced to you adolescents and described the issues affecting the Filipino adolescents. Okay, it's an introduction. Some are not there in the book, but generally, it would be better that we get to be familiar about this interesting stage of one's life. Sige, so I will start. I will be sharing my screen. Okay. Can everybody see my slide?
Yes, Doc.
Okay. Ayan. Sige, so thank you. So for this afternoon, I will be discussing the adolescent healthcare visit. Okay, so I will be, my references for this lecture will be from Neinstein's and Nelson's. Neinstein is the book for adolescents, and the Nelson's also, and the other articles. So this will be the outcome for our lecture this afternoon: to elicit a complete and accurate history, perform physical examination, including sexual maturity rating, and provide anticipatory guidance. And then These are our objectives. And then, so to start, so in 1997, the American Medical Association developed the guidelines for adolescent preventive services, and we called this the GAPS. This is a comprehensive set of recommendations which for adolescents, and this provides a framework for the delivery of preventive services package during a series of annual health visits between the ages of 11 and 21. So last month, I introduced to you the definition according to age group of adolescents, and that is 10 to 19. So here I will use the ages of 11 to 21. So iba-iba siya. So this is from American Medical Association. Okay. So these are the recommendations. It will be divided into 3 parts. For the first part, these are recommendations for delivery of health services. And second are recommendations for screening. And third are recommendations for health. For the first recommendation, these are for the annual preventive services visit. So this ranges from ages 11 to 21. So aside from addressing the medical concerns, it also addresses the psychosocial and developmental aspects, and it focuses on the preventive services. Okay, so always remember, when you deal with patients, you do not treat the patient with their concern lang, with their medical concern. For example, the patient will go to you for abdominal pain, because this is what we usually see in the clinic. I noticed some of the medical clerks in the OPD, when interns pala, postgraduate interns, when they assess patients, they only assess the main concern for the plan. So it is tailored only to the medical, to the chief complaint of the patient. So it would be better na starting this, while you're in med school, you're currently in second year, you will emphasize also the other management of patients. So that includes preventive or anticipatory care. Okay, that's why we need to take note of this. Okay, so you do complete physical examinations, particularly for adolescents. You do complete physical examination in each stage of adolescence. And then, so an adolescent-friendly clinic visit. We don't have this in our setting. I noticed, I'm affiliated with Eastern Visayas Medical Center. So there should be a training for nurses and other healthcare workers working in it's a team, and then the clinic should be adolescent friendly. Yung EVRMC, it is adolescent friendly clinic 3, pero the one handling is the OB department. So in our clinic, in Pedia OPD, so hindi pa talaga ito the adolescent friendly care clinic is not yet really being they call this, being emphasis, being anong tawag nun, being put into fruition for now. Pero preventive care for adolescent friendly healthcare visit includes tracking growth and development, providing anticipatory guidance, including immunization and assessing nutritional status. And then the second recommendation is preventive services should be age and developmentally appropriate and should be sensitive to individual and sociocultural differences. So what is an adolescent-friendly clinic? The waiting area should be relaxed, should be welcoming and developmentally appropriate. Age-appropriate magazines, hotline numbers, posters, and health education brochures are suggested to be at hand. So in our clinic in EVRMC, so walang separate clinic for adolescents, so mixed siya, especially during the during the pandemic, where there are limited patients that are being seen at the OPD. There is a barrier, the plastic barrier at the outside. So talagang the ideal setup is not realized. The examination room should be enclosed by curtains to promote a sense of privacy, and there should be an available area to host family meetings. Clinic hours, waiting time must be consciously set at the minimum. A lot more time for adolescent visits, which include a psychosocial history. So I don't know if I mentioned this last time, but it usually takes around 1 hour or more, 2 hours to the most, especially if the patient has many issues for psychosocial interview in adolescents. So you still have to talk to the parent or guardian after. And then clinic hours, it would be ideal if you have it after school or early evening hours to avoid missing school work. So this is according to Einstein's. It should be separate from non-adolescent patients. And for the third recommendation is confidentiality. So we need to assure confidentiality at all times, but there are limits, and I will be discussing the limits later. The reason for this to protect the patient from danger to self or to others, and then from abuse. And then next, so confidentiality, the physicians and office staff who see adolescent must be competent in the concept of confidential care and limits on confidentiality. For example, a teenage mom will go to your clinic for consult, so you cannot judge the adolescent. And then if there are other issues of the adolescents, wherein that will be their shift complaint, it should not be broadcasted to the clinic for other patients to hear. Third, it is the physician's duty to explain the adolescent's rights to confidentiality and privacy. There's a form of words for this. So this one was not taught to us when we were in med school, pero you will apply this when you have your clerkship, when you have your clinics, when you do encounter adolescent patients. So there's a form of words. You can say this. Before you go ahead with the psychosocial interview, you should mention this. I want to assure you that as much as possible, what we will talk about will remain between us, except when there is threat to self and others, and if there is abuse or any situation that puts you in danger. Okay, so that the patient will feel comfortable talking to you about anything, but he or she would know that there may be exemptions, especially if the patient, for example, has higher risk of suicide, for example. And then next is what's the difference in approach and format of the visit? So for adolescent clinic as compared to adolescent consultations, we need to see the adolescent alone. This is one of the ways in which we will support their emerging autonomy. Okay, pero that is for typical adolescents. I mean, for those with that has no developmental delays, for those with no hearing problems or other disability. You explore sensitive issues, and then you emphasize confidentiality. Then self-management skills for eventual transition, especially for patients with chronic illness. Okay, because we will transition them to adult healthcare when they turn 19. And an open, respectful, and non-judgmental attitude should be fostered at all times. So I have a pop quiz. I would like someone to volunteer yan. An adolescent health visit, or just answer true or false pala. The adolescent must be by himself or is alone during the whole course of the consult. Is that true or false?
False, no?
False. Oo, tama. So initially you will be talking. Who answered that? Thank you for answering. initially you will be talking to both the adolescent and the patient's parents or guardian. And then later on, during the part of the psychosocial history, you would ask the adolescent, the guardian to step out of the room so that you can go ahead with doing the psychosocial interview. Okay, and then at the end of the interview, you will ask the guardian or the parent to come in the room for wrapping up or for discussing the plans or management for the patient. Pero you still maintain confidentiality. Ibig sabihin, those that were not, that you have talked to the adolescent should not be discussed to the parents or guardian. Only those that are needed. I mean, kailangan malaman ng parent or guardian. So these are the steps in an adolescent health visit. So first, and I already mentioned this kanina, the other parts, no? So first, you have to introduce yourself to the adolescent, and then as compared to discussing to consultations with younger children, you ask the adolescent for the introduce yourself to the adolescent and ask for the adolescent's name. So you should not use words like iha. I heard someone said iha in one of the OPD clinics, ano name mo iha. So you use the name, you use the adolescent's names instead of mentioning iha or ano pa ba? Other words. It's the sweetest name that you can tell, that you can say to someone, their name. So you use the adolescent's name or you ask the adolescent how he or she wants to be called. Okay, and then second, you have to ask the adolescent to introduce the companion. So ito yung sinasabi ko na as compared to younger children, you have to ask, to support emerging autonomy, you have to ask the adolescent to introduce the companion. So we cannot deduce that the patient's companion is, for example, the patient's grandmother. And in fact, patient mother pala ng patient, or for example, an adolescent female, nakasama yung some adult looking male. So we cannot assume that it's the patient's father, pwedeng pala it's the patient's boyfriend. Okay, so, and it's also a way of empowering the adolescent. So you ask the adolescent to introduce the companion. Next, you have to talk to the adolescent and parent or guardian together. So this is the format. Initially talk to both of them first, and then you explain the format of the interview, including the need to see the adolescent alone. Okay. You need to you explain na you'll be talking to them first, sabay, and then you will ask you will tell the mother to step out of the room. So dapat alam nila yung format. And then you define the basis of confidentiality and its limit when both the parents or the guardian and the patient are around. Okay, so you have to tell them what are the limits. So you have the form of words, yung sinabi ko, yung the one that I told kanina. For example, in Tagalog, lahat ng pag-uusapan natin ay confidential. So you ask the adolescent ano yung pagkakaintindi niya with the word confidential. Then the adolescent will, kung alam niya, or if not, then you will explain. And then you will tell them, however, or ngunit kung meron kang mabanggit na sa tingin ko ay pwedeng ikapahamak, may kapahamakan sa buhay mo, sa ibang tao, or may pang-aabuso, or sa tingin ko pwede mong ikapahamak, I might have to say this to your guardian because I am worried about your concerned about your safety. Okay, so that you will use such statement. Okay. And then you elicit the medical history from both the adolescent and parent or guardian. And then, so especially the past medical history, the family history, the immunization history, and developmental history. And then you negotiate to see the adolescent alone, and you proceed with doing the psychosocial interview. Before you proceed with the psychosocial interview, you have to, you can reiterate asking the the patient, mentioning the confidentiality clause to the adolescent alone. Then do a physical examination. It would be better if you have a chaperone or um, same, gender colleague. But if the patient is not comfortable, for example, you have to explain, if, for example, doing the SMR, the Tanner staging, sexual maturity rating, if the patient is not comfortable having that part of the physical examination, you can ask the adolescent to identify what stage is he or she in by letting the adolescent see the chart. Tapos siya yung mag-identify kung SMR stage 3 or 4 na siya. Okay? Just indicate in your physical exam that it was the patient who identified and hindi ikaw. And then next is make an assessment and discuss plans with the adolescent, including issues that need disclosure. Okay, so you will discuss, when you discuss the plans with the adolescent, you also mention, so you give a summary, you also mention the strengths of the adolescent. And then you discuss the issue. So, like what I mentioned kanina, you cannot disclose all information to the parents. I hear na pala ako. Sorry. And then call back the parent, do wrapping up, and set up a follow-up date. Okay. So that's the end of our adolescent health visit. So we should do this, okay? Kasi when I was in med school, we were taught this, and then during your actual clinics with actual consultation with adolescent, you take note of these steps, okay? And the next recommendation for screening, we have the following for hypertension, for other like hyperlipidemia, eating disorders, and the rest, alcohol and other substance use, risky sexual behavior, sexual transmitted diseases, HIV, pap smear, depression and suicide, abuse, learning or school problems, and TB risk. Okay. So for the adolescent health maintenance, so for taking the history, you need to do it for all categories, no? And then it's annual for each stage of adolescence. Comprehensive physical examination for each stage of adolescence. It's annual. And then for sexual maturity rating, once during early, middle, and late adolescence. And scoliosis, the Adams forward bend test for all, especially for females 10 to 12 years old and males 13 to 14 years old, though this is common among among female adolescents. And you need to get the measurements of the height and weight that should be done annually, the body mass index, and the blood pressure. For psychosocial assessment using crafts, using heads or craft, it is annual. Depression screening using PHQ-9 modified for teens. Are you all familiar with this one? Yung PHQ-9. Are you all familiar with this? So I think silence means no, so no. Sige. And it's should be done annually starting at 12 years old. I think I mentioned this in my lecture before in one of the studies for school age for adolescent, for high school students pala. In screening procedure, so you need to assess for anemia. So hemoglobin or hematocrit should be done at all stage of adolescence. So once during early, middle, and late adolescence. And urinalysis, hindi siya recommended. For example, an adolescent will go to your clinic, tapos patient has concerns, you need to do CBC, CBC. So annually, urinalysis, hindi naman siya recommended. It is only limited for patients who are at high risk for chronic kidney disease. And tuberculosis, you only screen those with exposure and with signs and symptoms suggestive of TB. And then for dyslipidemia, I will discuss this later. Vision and screening is universally performed at 10, 12, and 15 years old, and hearing once during early, middle, and late adolescence, and referral to dental home or dentist every 6 months. Okay, so medical history should be complete. Necessary data is collected from both the adolescent and the companion. So you need to ask the following: what's history of present illness, review of systems, the usual past medical history, immunization history, developmental history, gynecology, the menarche, and family history, mental health, etc. So the psychosocial history for an adolescent health visit is the heart and soul. Yes, it's the heart and soul of our consultation, and you need to do the heads. Complete examination should be done during early, middle, and late adolescence, according to Bright Futures from the American Academy and the American Academy of Pediatrics. And then when doing a physical examination, you need to inform the adolescent and the parent or guardian. They need to do the sexual maturity rating. You ask permission. You provide privacy. Use the opportunity to educate and the need for a chaperone. So the highlights in the anthropometric data, the height and weight. Okay, so there is a table for that. Pero we need to, for nutritional status, you need to get the body mass index with nutritional status assessment using disease score, the heart rate, blood pressure on both arms while seated. So I noticed during our screening, here. Z-score interpretation based on WHO growth chart of BMI for age. So underweight is below -2, normal is between 1 to 2, overweight is above 1, and obese is above 2. So there is a table for that. I just want to share during our screening for patients with for vaccination for adolescents 12 to 17, we have noticed that there are a lot of patients who are overweight. So it is also overweight and obese. No, so it is one of our part of our management to educate them on nutrition. Okay, so when you identify this in your and the anthropometric data, you need to tell the adolescent that you are concerned as your physician. I am concerned about your weight. You can tell them, you can ask the adolescent if she is comfortable with her weight or meron ba siyang gustong baguhin, how can she go about this, okay? Then BP level interpretation. So this is a BP updated version definitions of BP categories and staging and stages according to the CPG for screening and management of high blood pressure in children and adolescents by the American Academy of Pediatrics in 2017. So for ages, for children aged 1 to 13, so ito yung normal BP. For children aged 13 years old and above, so as parang adults na siya. So if it is less than 120 to 80, that is normal BP. No? If it is less, if it is 120 to less than 80 to 129 over less than 80, that's already elevated. So you indicate that in your assessment. So aside from other assessment na, for example, the patient has gastritis or whatever, you include also elevated BP as your assessment and the nutritional status if the patient is obese or overweight. Then if the BP range is if the BP is 130 over 80, that's already stage 1. And to 139 over 89. And if it is more than 140 over 90, that is stage 2 hypertension. So for this, for when you see during the first visit, when you see an adolescent with this BP, do you need to give antihypertensives initially? What will you suggest to the adolescent and to the guardian? If you see that the BP is 130 over 80, do you need to prescribe antihypertensive medications?
Yes po, Doc.
Ano yun? Who answered?
Yes, hello, Yani.
Yani, do you need to prescribe?
Not yet po, Doc.
Okay, what would be the best management for this patient man who initially note po that patient has stage 1 hypertension, for example? What will you advise to the patient?
Diet modification and exercise. Tapos, di ba, Doc, kailangan i-assess again after 3 months or after a month.
Tama.
The
So you
same, lagi hapit BP.
okay, so tama. You cannot prescribe right away an antihypertensive medication. So lifestyle modification, it includes exercise, proper nutrition, okay? And then reassess, or maybe you can ask the adolescent to have a BP journal with her para ma-monitor. For example, every 2 weeks, get the BP, and then kung ano yung proper way of getting the BP. So dapat the patient is comfortable, okay, the right cough, BP cough, and all, okay, the health center. So you should also advise how to do the proper way of taking the BP. Okay, and then you let the patient follow up after a month. Let's just assess kung may other concerns man, and then let's see kung ano yung reading. And then to do the review of systems, we do physical examination, you assess the following, no? You assess for adolescents, you assess the acne, if the patient has acne, kasi there are many hormonal changes, no, during adolescence. And you also assess for other skin problems, aside from acne, other skin problems. Uso din yung keratosis pilaris, KP, we have scabies, warts, fungal infections, and other lesions. You also note for this for piercings and tattoos. So when an adolescent arrives in your clinic with a cough na makapal and black, you also need to assess if the patient has superficial cuts. So there are many adolescents who has this NSSI, non-suicidal naman. Pero this is already a warning sign. This already will alert you that the patient needs to be really assessed. Need to do a thorough psychosocial history. So aside from checking on the skin dun sa arms, where else ba? Yung may kita mo yung mga cuts, mga hesitation cuts, or the superficial linear cuts as sign that the patient has attempted to harm herself. Saan pa? Aside from the arms, saan pa ba makikita? Where do you see these cuts? Diba, usually sa wrist. Saan pa ba? Who would like to answer?
Sa legs, no?
Oo, tama, sa thighs. Pwedeng sa thighs. Oo, sa inner thighs. Pwede din sa abdomen. Those na hindi nakikita, no, nakatago. Meron din sa paa. I've seen some na sa legs, sa lower leg. Pero usually kung sa paa, usually sa thighs, sa inner thighs, no, kung nakatago. And then that's why you have to do a therapy if an adolescent arrives to you na mainit naman sa labas. Pwedeng fashion statement that she's wearing a jacket, tapos naka-cuffs, pwedeng yung kanyang identity, she wants to yung mga gothic like na pero it's also pwede din their way of hiding some of their cuts. That's why you have to assess, you have to ask if you have to check for the arms, the inner thighs, and the abdomen for cuts, okay? The piercings and the tattoos. Pero this does not mean that the patient, you cannot judge that the patient is already very unruly because of this findings, the tattoos and piercings. Pero you can also check if the patient has yung sa mga gangs, they have this characteristic na mga brand, mga tattoos and others. So pwede mo din makita. Okay? And you take note of that in your PE. And then for the teeth and gums, you check for evidence of dental caries, enamel erosions, or gum infections. So this usually not emphasize yung dental hygiene, no? So many of the adolescents, even kasi younger children, they should be taught na at a younger age, dapat they would be brought to the dentist. So especially pag umabot ng adolescents, so kasi they are they usually have fewer consoles, so ito napapabayaan na. So you also have to check for those, okay? Dental caries, and then you also suggest as part of your plan, since a note mo on your physical examination, so part of your plan will be to have the dentist see, have the adolescent see a dentist, okay? And then for the next check for thyromegaly or adenopathy, this acanthosis nigricans for patients no who are obese or maybe the family history of diabetes. So you have to check for that. And then for cardiopulmonary naman, you check for heart rate, heart murmurs or clicks, observe the breath sounds. In middle adolescence, there is usually an increased heart size or higher blood pressure and increases in blood volume and hematocrit, which is particularly common in males. And then, ayan. And then, dito pala sa ano, you also note for the changes, no, kung changes sa voice, very characteristic also of adolescents, especially for males, vocal quality in males. Sana ba ako? Here. Sa breast, so you examine for symmetry and development. In girls, you assess the sexuality maturity rating. I will be discussing that later for masses or discharge. Pero, this depends lang on the concern. No? If the adolescent's concern is, for example, enlarging for there is tenderness or there is mass felt on the breast, then you do breast examination. So this is not recommended for every health visit. Kung if it warrants lang, for example, the adolescent male, for example, if the adolescent male complains of enlargement, so we can say, but this is normal, present in 1/3 of boys. If it is less than 4 centimeter in size, usually regresses within a few months and do not persist for more than 2 years. You have to assure lang kasi some they will go to your clinic, they will be hesitant to share with you kasi for fear na baka ma-ostracize if they have enlarging breast. Okay, so you have to assure the adolescent male. Pero you don't do physical breast examination for all adolescents kung wala naman silang complaints. You don't do breast examination. You don't do palpation. You can just assess the appearance. Abdomen, you check for hepatosplenomegaly, tenderness, and masses. And then for musculoskeletal, important here is the note for scoliosis. For athletes, there's overuse syndrome and osteochondrosis. Evaluate for scoliosis. For premenarchal females, 10 to 12 years old, as mentioned kanina, an orthopedic referral if the curve is more than 15 to 20 degrees and if spinal growth is not completed. So you have the Adams test, the bend forward test. So you check for, you can see here, no, it's an even shoulders, an even scapula, the curvature of the spine. This is already very an equal space between arms and torso. Some are not like this, no, hindi pa masyadong grabe. Pero if you assess that there's already asymmetry of the shoulders and scapula, kahit slight lang, you immediately refer the patient. Then you do neurologic examination, you test the strength, reflexes, and coordination. And for the genital examination for genitalia, if warranted lang, you don't do it for all patients. For example, an adolescent male will come to you with penile discharges. So you examine the penis and the testicles to check for hernias, varicocele, signs of sexually transmitted diseases. So the psychosocial history will be really significant at this. You will correlate it with your psychosocial history and your physical examination. Genitalia, inspect for discharges and lesions. Okay, so I included this in the slide. So puberty, I think I discussed this last time, is the biologic transition from childhood to adulthood. What is it here? Sige lang. So this is, the pubertal changes include the appearance of the secondary sexual characteristics, increase in height, change in body composition, development of reproductive capacity. So these are just some of the developmental changes. And the hormone, adrenal production of androgen, we have mainly dehydroepiandrosterone. Androsterone sulfate may occur as early as 6 years of age with development of underarm, udder, and faint genital hair adrenarche during adolescence. And um, the earliest, one among the earliest neuroendocrine changes associated with the onset of puberty is the maturation of the gonadotropin releasing hormone GnRH pulse generator. So we have let us include this. Wait lang. So we have the different hormones that come into play. We have follicle stimulating hormone, and the FSH, which are very, especially in menarche, in menstruation for adolescents at this stage, in adolescence. So I would like to ask. So we will be discussing here the sexual maturity rating. So why is this important? So this is parang a biological, a landmark to assessing the patient has precocious puberty or other developmental delay. So we correlate this with our patients, with the patient's age. So the progression of the development of secondary sex characteristics may be described using the sexual maturity rating scale. So it ranges from one, I will let you see the table later. So although the stages at which individual pubertal changes may occur, may vary for both males and females, the timing and sequence of these changes relative to one another is very predictable. This range of normal progress through sexual maturation is affected by genetics. We have psychosocial, environment, nutrition. That's why you need to get the nutritional status of the adolescents, especially for those undernourished, and the overall health status. Environmental exposures may play a role as well. So we have here in males, what is the first visible sign of puberty for males? Do you know? You can see it in this graph now.
Testis enlargement of
Also tama, enlargement of the testicles. Enlargement of the testicles. And for females naman, what is the earliest sign of puberty? Telarche. So it's telarche. So you can see here that there are variations in the onset of the different stages. Now for particularly for the somatic growth, for the linear growth rather. And then for males, so as mentioned kanina, the first visible sign of puberty and the hallmark of SMR2 is testicular enlargement, beginning as early as 9.5 years, followed by development of pubic hair. Pero sperm may be found in the urine by SMR3. Okay? Nocturnal emissions, yung wet dreams, may be noted at this time as well. So we have, this is followed by penile growth during SMR3. And then peak growth occurs when testis volumes reach approximately 9 to 10 cubic centimeters during SMR4. Okay, under the influence of luteinizing hormone and testosterone, under SM4 rather. Thus, under the influence of testosterone and luteinizing hormones, other seminiferous tubules, seminal vesicles, and prostate will enlarge. And then some degree of breast tissues growth, typically bilateral, occur in 40 to 65% of males during SMR2 and 4. As presumed consequence of a relative excess of estrogenic stimulation, which usually resolves with ongoing maturation. And then, so here, the peak height velocity for males is at SMR 4 to 5. Ayan. Peak height is compared to females, which is earlier. So I think I mentioned this kanina. First visible sign of puberty and hallmark as of SMR2 is testicular enlargement, beginning as early as 9.5 years. Next is development of pubic hair, then penile growth during SMR3, and peak growth during SMR4. So can you identify what Tanner stage am I showing you? Who would like to answer? Anong stage of anong SMR stage ito? Okay, so no one wants to answer. So here we can see here the different stages of the enlargement of the testicle. I mean the penile growth, testicular growth, and the pubic hair development. So in assigning SMR in boys, okay, so you need to observe the following: the pubic hair, the penis, and the testis and scrotum. For stage 1, it's pre-adolescent, so there's no pubic hair except for the fine body hair, the villus hair, similar to that on the abdomen. So it is same size and proportions as in childhood for penis naman, same as for the testis and scrotum. For stage 2, there is sparse growth. So take note of this. This is quite, I don't know, for me during before, it's quite confusing. You have to take note. Sparse growth of long, slightly pigmented downy hair, straight or only slightly curled, chiefly at the base of the penis, light or no enlargement for penis. And then this is larger for testis and scrotum. Here naman, it is darker, coarser, curlier hair spreading sparsely over the pubic symphysis, and the penis is larger, especially in length. And then this is further enlarged. And here naman, it is coarse and curly hair, seemingly like that of the adult. Area covered greater than in stage 3, but not as great as in the adult. Not yet including the thighs. Here naman, it spreads to the medial surfaces of the thighs, but not over the abdomen for stage 5. And then for stage 5, it is the penis is adult in size and shape, and then this one as well. So kanina, ito hindi masyadong clear yung hair, pero the one that I showed kanina was stage 3. Okay? For females naman, as compared to males kanina, we're in the peak height velocity is at 3, is at 4 or 5. Here naman is at SMR 2 or 3. So here we have Dilarche, pubic hair, and then peak height velocity. And then menarche, the station is at stage 3 or 4. Okay, these are the Tanner stages and pubertal events for females. So what is the visible sign of puberty? You mentioned kanina, no? Someone answered already, it's Dilarche. Okay, it's the appearance of the breast buds or the Dilarche between 7 and 12 years of age. A significant minority of females naman develop pubic hair prior to Dilarche. So some lang, pero usually it follows after Dilarche. So less visible changes include naman the enlargement of the ovaries, we have uterus, the labia, and the thickening of the endometrium and vaginal mucosa. We also have physiologic leukorrhea, which may be present before menarche, clear or vaginal discharge. And then menses typically begin within 3 years of menarche during SMR 3 or 4. Average age is 12 12.5 years, and normal age is 9 to 15 years. Okay, and then the timing of menarche is determined largely by genetics. Also, we have also in adiposity, malnutritional status. Okay, for those with chronic illness, talagang we can observe when we ask if they have menstruation, usually they don't have yet, say they're already 18 because of the nutritional status. For example, those with chronic kidney disease, mga ganon. And the physical and psychosocial environment as well. Yeah. So the onset of puberty and menarche appear, pero in the US they appear, they appear to be they occur at earlier stages, okay, than other races. Okay. Can you identify what standard stage am I showing you? Okay, who would like to to answer? If you will cooperate, now we're almost done. Anong stage of SMR stages am I showing you? What is this?
4.
Four. Sige, let's see. Yun na. So you answered. Tam, who answered it 4? Thank you. So this is a female pubic hair. So stage 1 pre-adolescent, no pubic hair except for fine body hair, like similar to that of the abdomen. And then stage 2, we have sparse growth of long, slightly pigmented downy hair, slightly curled chiefly along the labia. And here we have darker, coarser, curlier hair spreading sparsely over the pubic symphysis. And then stage 4, tama, the one who answered kanina, coarse and curly hair as in adults, but it does not reach the thighs yet. So in difference with the stage 5 is that it spreads on the medial surfaces of the thighs, but not over the abdomen yet. Okay, excuse me, just drink water. Okay, for this, so another pop quiz. For this picture, what can you identify what Tanner stage am I showing you? Who would like to answer this time? Anong Tanner stage na ito? 2. Okay, let's see. Si Charming, thank you for answering. It's stage 3. Okay, it's stage 3. So pre-adolescent elevation of nipple only, breast bud stage elevation of breast. So the difference, elevation of breast and nipple as a small mound, enlargement of areolar diameter, further enlargement of elevation of breast and areola with no separation of their contours. And in here naman, separation, projection of areola and nipple to form a secondary mound above the level of breast. And then here, the stage 5, mature stage, there's projection of nipple only. Areola has receded to general contour of the breast, although in some normal individual, the areola continues to form a secondary mound. So these are the difference between the two. So ito, may small mound. Ito, there is no separation of their contours. In stage 4, there is secondary mound above the level of the breast. And then here, like that of the projection of the nipple only. Okay. So to continue, so we'll proceed naman to the growth spurt. So this is the awkward stage wherein the the adolescents, distal parts like the arms and toes usually are the first to, the arms rather and the feet are usually the first to grow, and then so distal, and then later on the arms naman and the legs. That's the awkward stage. So Di ko na. So, linear growth, di ko na change. So, linear growth acceleration begins in early adolescence for both genders, with 15 to 20% of adult height accrued during puberty. So, as you saw, as what I've shown you kanina on the figure, that at the females attain a peak height velocity of at SMR 2 or 3. So it peaks at 8 to 9 centimeters per year at SMR 2 to 3, approximately 6 months before menarche. And for males naman, they begin their growth acceleration at SMR stage 4, achieve SMR 3, achieve a peak height velocity of 9 to 10 centimeters per year later in the course of puberty, SMR 3 to 4. Sorry, stage 4. And continue their linear growth for approximately 2 to 3 years after females have stopped growing. That's why we notice in elementary, usually the females are taller, and then when we go to high school and college, the males will catch up. So the growth spurt begins distally with enlargement of the hands and feet, followed by the arms and legs, and finally the trunk and chest. So this is what we call the strength spurt for males. So to continue, pelvic examination is not routine for it's not routine doing the PE when we do our PE for female. So it is only indicated if there are active complaints of pelvic pain, vaginal discharge, severe menstrual disorders, and then we refer them subsequently to the gynecologic service. Okay, pero we can investigate naman. And then you do annual, pero you as recommended by Einstein and ACOG, you do annual pelvic exam and PAP screening every 3 years, beginning 21 years. Okay, so during adolescence, hindi pa. And then regardless of age at coitarch or first sexual activity. American obstetricians and gynecologists pala, gynecologists. And then for visual screening, you do it at 10, 12, and 15 years old, using the Snellen chart, and refer if the vision is less than 20/30. And for hearing screening, once during early, middle, and late adolescence. And for laboratory examinations, I think I discussed this earlier. At first encounter, you get you get the CBC, hemoglobin determination to check if the patient has anemia, especially for adolescent females who has started their menstruation. Urinalysis, so it is not routine. You only do it for patients with chronic kidney disease and if they have other concerns pertaining to the urinary tract. We have tuberculosis screening for those with exposure only, cholesterol levels for those with a history, or for those with obesity, or for those with history of family history also. And when you do your when you have your blood pressure and the patient's BP is elevated and the nutritional status is overnourished. So if there are no risk factor, test once during adolescence. So it is late adolescence, so 18 to 19 years old. And then if with risk factors, do cholesterol and fasting triglycerides as mentioned kanina. Okay, sorry. If no risk factors, you do it once during late adolescence at 18 to 19 years old. And if with risk factors like family history, if the BP is elevated, and if you note in your physical examination that the patient has, say, acanthosis, significance, you do cholesterol and fasting triglycerides. And then this is the lipid profile testing for 9 to 11 years old, universal screening. This is according to AAP and AHA in 2018. For 12 to 16, no routine screening unless with risk factors. So these are the risk factors: family history, and then 70 to 21, universal screening, fasting lipid profile. Okay. This is the acceptable lipid profile interpretation. So there is low, acceptable, borderline, high for when we this is for adolescents according to American Academy of Pediatrics in 2011. And then, as mentioned kanina, we will advise the patient to have lifestyle modification first. Pero if with consistent elevated cholesterol, we can already start giving medications. And for the next part, screening for sexually active adolescents for females less than 25 years old. These are for sexually active adolescents, okay? Screen annually for chlamydia and gonorrhea, and the cervical cancer screening using pap smear at 21 years, and every 3 years, whether sexually active or not. For pregnant adolescents, you need to include, aside from other tests, you need to include for chlamydia, gonorrhea, syphilis, HIV, and hepatitis B. So this is routine. And then for males, no routine screening. You perform only in high prevalence clinical settings or upon request. Pero for MSM, men who have sex with men, you screen annually for HIV, for chlamydia, gonorrhea, and syphilis. And tests to be repeated every 3 to 6 months if at increased risk. Obtain specimen from sites of contact, urethra, rectum, pharynx, regardless of condom use. So during my training in PGH, we have had patients who go to your clinic because of other concerns. Pero when you do psychosocial history, you identify that the patient has sex with other men, maybe for money. Okay, so you request. So even if the concern is different, you have to include this test for screening. Okay, so you'll tell the patient that you are concerned because the patient has risky sexual behavior, so you want to screen lang if the patient has STDs. Okay, we have had patient na she is not aware of the consequences, especially if with unprotected sex. So the patient had HIV upon screening, only detected upon consult at the OPD. Okay, so as physicians, it is our duty to inform them, okay, and to include this in our tests. Immunizations, you check if immunizations are up to date. You ask for documentation. So usually for adolescents, the guardians or the adolescents themselves are not aware that they have to have vaccination. They thought na it will end during during childhood, so they're not aware that they have catch-up immunizations. So we have here a table of recommended vaccines for the adolescent age group. So you have to include this in when you have your consultations, no, at the OPD, kasi they're not aware, especially HPV, which is given at this stage. So it's not given kapag adult na. So it's given during adolescence. So TD or Tdap, for all adolescents, we have their scheduled immunization. And then for influenza vaccine, which is annually beginning February, it's actually 9 to 18 years old. For HPV vaccine, so there are two types. We have bivalent, we have quadrivalent, and non-avalent. So for bivalent, we give this to females, okay? So yung quadrivalent, yung bivalent, you don't give this to males. So bivalent, 15 to 18 years old, you need to give them 3 doses. So at 0, 1 to 2 months, and 6 months. So ito yung interval, okay? You have to take note of this. Females, 9 to 14, so earlier age, you give 2 doses only, okay? At 0 and 6 to 12 months, okay? So you will instruct the adolescent if for some, they have this in their school. So maganda if they have in their school. Pero for others, na wala, you have to instruct them to go to their pediatrician to have their HPV vaccine. Okay, for adolescents, you instruct the females, the mothers also, or the guardians, especially for those with higher risk if they have family history of cancer. HPV vaccine quadrivalent for 4 types. So we have females, so 3 doses then. And then for females at this age, 2 doses, same with the bivalent, okay? Pero for males, so you have to tell them na hindi lang for males, no? For females, prevention of cervical cancer. We also have other types of cancer that can be prevented, especially for males, genital warts, other forms. We have also colon cancer, other forms of cancer. For 15 to 18, like that of the female, 3 doses, and for 9 to 14, 2 doses. Okay? And we have the Japanese encephalitis, 9 months to 17 years old, 0 to up to 24 months, 18 years and older, you need to give 1 dose only. Okay? Okay. Ay, ito. Catch-up vaccination, I have another pop quiz. Catch-up vaccination must be restarted once the child has reached adolescence and still with incomplete vaccination. Kailangan pa ba ng catch-up? Is it true or false? Kailangan pa ba? Or just answer me true or false. Yun lang, you can just choose between the two. Is it true or false? Do you need to have catch-up immunization to restart rather catch-up immunization for a child, for an adolescent who has not started or has incomplete vaccination? Okay, so no one's answering. So, ano yun? Is it true or false? Someone was trying.
False.
False. Oo. Dapat confident. Yes, it is false. Oo, tama. So it can be done if the administration of the following vaccines were not completed during childhood. So there is no need to restart. Okay, so tama yun. There is no need to restart. There is a recommended dose. Okay, if no documented dose, to initiate the series following the schedule. So we have a schedule here for catch-up vaccination. Okay. For hepatitis B, unvaccinated 9 to 18 years old, we have 3 doses. Inactivated hepatitis A, we have 2. MMR, we have 2 for 9 to 18 years old. And incompletely vaccinated, for 9 to 18 years old, only 1. You need not to restart, okay? And then for varicella, for all adolescents, unvaccinated, 9 to 18 years old, we give 2 doses. And for vaccinated more than or equal to 13, we give only 2 doses as well. And the minimum interval is 1 month. Okay? And for those incompletely vaccinated, 9 to 18, you only give 1 dose. Okay? Please take note of this. This is already updated from the PPS recommendation in 2020. And then for the other vaccines for special groups, we have meningococcal conjugate vaccine, we have rabies, typhoid, only for those at-risk individuals, pneumococcal conjugate vaccines, cholera, and vaccines in pregnancy. So we have teenagers who had, pregnant teenagers. So fully immunized pregnant adolescent, we only need 1. Given at 27 to 36 weeks age of gestation, regardless of previous TB or Tdap. And for unimmunized pregnant adolescent, you need to give 5 doses. Okay, so 5 doses of tetanus diphtheria containing vaccine following a 1, 6, 18, and 30-month schedule. And then influenza vaccine, inactivated intramuscular preparation for pregnant adolescent as well, given at any trimester. Okay, 1 dose needed only. Okay, for the other recommendations for health, we have health guidance education to parents, health guidance education to adolescents, reduction of injuries, kasi as mentioned, the most common causes of morbidity and mortality are psychosocial, we have vehicular accident rather, and other risky behaviors of adolescents, nutrition, physical activity, responsible sexual behaviors, and avoidance of substance abuse. So these are the recommended recommendations to parents and adolescents. We have normative adolescent development, including physical. You need to inform the parents rather, of the adolescent development, physical, sexual, and emotional development. Recognition and appreciation of normative teen development can minimize difficulties between parents and their teenagers. So we have to understand, kasi the guardians or the parents will label their adolescents as pasaway. For example, they want to have their independence. The parents should know that there are different ways of handling adolescents, so different from that of their younger children. So they should be aware of the changes, the physical changes and the psychosocial changes happening to the adolescent. Okay, so dapat they're aware. And then the signs and symptoms of disease and emotional distress. So you have to tell them, you have to emphasize to them what are the red flags. So kasama na how to identify if the patient has depression. It's common, and you have to tell them how to go about it. So you have to educate the parents that you cannot dismiss the concerns of adolescents, because they will say, especially for for those very conservative parents, that the adolescent is only nag-iinarte or napapapansin. Okay, so they have to acknowledge the concerns of these adolescents, kasi this may be a sign that they're already asking for help. Okay, parenting behaviors that promote healthy adolescent adjustment. So it's really different. It's really a different approach on handling adolescent issues. So you this is how you advise them. You listen and show interest in the adolescent's activities, avoid power struggles. The patient should remain flexible and solve conflicts together using a collaborative approach. Yeah, spend time together and create opportunities to have one-on-one, demonstrate trust. Okay, take opportunities to reinforce the positives or the strengths of the adolescents. And the adolescents need firm, fair, and clear-cut limits. So we also need to set boundaries. So you have to make rules. For example, adolescents who want to go out with friends, so they should establish rules. Or adolescents who want to play video games, want to stay up late, so they should have rules in the house which should be followed. And also we should also firm, fair, and clear-cut limits also include household chores. So you have to, so it's very different. Meron na bang parents here, or are you all, meron na bang may family of their own among you? Wala pa? Okay, sige. And then these are recommendations to parents. So there are different styles of parenting, of authoritarian, permissive, authoritative, and uninvolved. So ito yun, they're different. So this authoritarian focus on obedience, punishment over discipline. Permissive naman, do not enforce rules and just allow the kids to be kids. Uninvolved, provide little guidance, nurturing, or an attention. Authoritative, so this is the idea. So we have to create a positive relationship while enforcing the rules. We have to be strict and warm at the same time. We have to foster this attitude. So this, I have place here something. Authoritative, you should be warm and loving, develop firm and consistent but not rigid guidelines, and foster independence. Okay? And the other recommendations, ito to safety naman, kasi risk, among the number one cause of mortality is vehicular accidents. So for those riding a car or merong car, emphasize the use of seat belts. GAPS recommendation 6, reduction of injuries. Okay, seat belts. And then do not drink or use drugs while driving. Emphasize. So for nutrition naman, the GAPS recommendation 7, we have nutrition, eating a low-fat diet. Eating a low-fat diet. So we have the Pinggang Pinoy. So this applies to all age groups, merong for kids and for adolescents. Okay, so at the back, there is a table for this. May indicated na number of cups per age, kung ilan ba yung serving of carbohydrates, ilang cups. And then for protein, ilang matchbox of and then for glow and go. And we can see the proportion na mas malaking proportion ng glow foods, no? Than go and grow. Then grow. So we have here go. And then pero this is what we can very easy to memorize. Yung 52100. This applies for adults as well. So 5 or more fruits and vegetables each day. So maybe dalawang serving in the morning, dalawa in the evening, lunch and evening. So iba-iba siya. Fruits and vegetables. So 5 servings and 2 hours or less of screen time. Ideally, before the pandemic, but this does not apply ngayon. Okay, kasi they have online classes, they have other activities wherein they have to meet up with their group mates, no, or maybe catch up with friends. Pero since ngayon na medyo lax na yung rules that they can go out with friends, pwede, you can still enforce, and then you have to take note of the quality as well of the screen time. So you have to be familiar with what videos they're watching. Kasi we have had patients na well, I saw one last month na she was raped kasi so dapat you teach them online safety, no? Yung online safety, accepted a stranger's request, the stranger pretended to be an adolescent, tapos asked to meet up with the adolescent, and the adolescent obliged naman, she was raped. So these are just some of the things that we have to advise also to patients and parents as well. Online safety. So 2 hour, baka this can change, pero you'll see after pandemic, pero there should be rules and you should know the quality and quantity of the videos or of the sites that they visit. Then next is 1 hour or more of physical activity. So as mentioned kanina, we have noticed an increase in the trend of patients who are obese or are overweight. So you should encourage them to watch. They can even watch videos, diba, online or YouTube on other physical activities. So encourage them. Pero ngayon, since we can go out, can encourage them to go out, to have brisk walking, to do activities that they enjoy doing with the caution. For example, they want to ride a bike, you should also wear protective gears, kneecaps, and the helmet, okay? And no sugary drinks or more water. No sugary drinks. So sweetened beverages, milk tea should be, hindi pwedeng i-cut off totally, maybe bawasan lang or as much 0, okay? And then other recommendations, so getting regular aerobic activity, so I mentioned this already. Okay, for those sexually active adolescents, using condoms if sexually active, or abstinence if not sexually active. So I don't know if you were taught comprehensive sexuality education when you were in school. Meron ba? Any of you? Were you taught comprehensive sexuality education? So that includes contraceptives, yung mga ganon. Hindi, no? Okay, kasi it's already recommended by the Department of Health or Department of Education. So it should be included in the curriculum. Kasi as much as you would like our teens to not engage in these activities, there are some who does, and then in the effects, we have an increase in teenage pregnancy, and then kasi they were not taught, it is a taboo, especially in our culture, kasi we are Christian country. So it would be ideal or na isama comprehensive sexual education. So it's not only about sex. So it's also about the patient's self-worth and all. Okay, patients, what are the means of contraceptives? What are the consequences? Ano yung effects, advantages of using this and not. So For those sexually active, especially for those men having sex with men, using condoms can prevent you from having sexual transmitted diseases, okay? Pero for teenage females, for example, if you do encounter, part of the counseling will be to include use of condoms, and then use long-acting reversible contraceptives. For example, for teenage pregnant teenage mothers, part of your you can educate them on use of long-acting reversible contraceptives to prevent the rapid repeat of pregnancy. Okay, so we do that in our patients, teenage patients, okay, in teenage mothers na patients in PCH. Okay, we recommend that kasi as much as we would like na hindi sila bubuntis, there are some who gets pregnant magkasunod the next year, okay? Kasi they were not taught, especially if they live together and if the parents will allow. So it's a different topic, pero yun, so we should educate them. And but the first talaga is abstinence if not sexually active. And for those sexually active, okay? Responsible sexual behaviors. And next, not smoking. So GAP's recommendation, avoidance of substance use. So that includes smoking. So that includes vaping, no? Smoking, kasi they thought that vaping is the lesser evil. So we have to tell the adolescents first, ano yung views nila about drugs, about smoking, and then tell them the effects, okay? And then, so I think that's the end of my lecture. Ay, meron pa pala. So for the adolescent health visit, you need to take note of this. So SAVE, so that is for screening, medical, psychosocial, you do physical examination and basic labs na recommendation, assessment for risk and protective factors. I will discuss this kahit konti lang later, and then you need to emphasize them to update their vaccination and education for both teens and parents. Okay, so in summary, I discussed the annual visits of adolescents are an opportunity for us to reinforce self-promotion for both the adolescents and their parents, to identify, initiate health risk behaviors, early stages of physical or emotional disorders, provide immunization, develop relationships with the adolescents that will foster an open disclosure of future health information. Hindi pa siya thank you kasi I will discuss sa inyo about psychosocial history. Okay lang ba? This will just be short. Okay, kasi you will be using this in your clinics. Though, baka I will be discussing this when we go to Okay lang ba? I will have a short lecture lang on doing the psychosocial history. Okay lang ba? Sige. It will just be short. Susulitin ko yung 30 minutes. Wait lang. This for third year. Pero very lang. I will go through the other slides na lang. Can you see my slide?
Yes, Doc.
Okay, thank you. So, ito, adolescent. Okay, I will not be discussing this. I think I already. So, as mentioned, the major cause of morbidity and mortality for adolescents are the psychosocial behavior and lifestyle problems. I think I discussed that already. These are the purpose of doing psychosocial history: to build rapport, identify the risk and protective factors, identify areas for prevention and intervention. There are many barriers. This includes fear that health workers will scold them, will judge them, ask them difficult questions, and will not maintain confidentiality. So will not, they usually do not trust the healthcare workers. That's why we have to foster this attitude. So first, we have to be respectful and non-judgmental, especially for teenage mothers. Kasi di natin alam yung context pala, baka the reason why they're pregnant is that patient was molested or victim of abuse, di ba? And for those, for example, adolescents who are parang seen pasaway, like di pasaway na naglalayas. Maybe the reason is that yun nga, patient is abused in the house or abused physically or sexually. So we should not judge. Begin at whatever age the adolescent first exhibits the psychosocial changes. Conduct the interview when the adolescent is relatively well. And situations of crisis or illness may sometimes facilitate effective history taking. Okay. So an adolescent healthcare provider should be trained in adolescent characteristics and issues. They should be friendly, courteous, and respectful, and hurried, gives adequate time for client-provider interaction. So this is not really, even for pediatricians, I noticed some are not comfortable really talking to adolescents. Okay, so it's a skill that you have to learn when you talk to adolescents. You have to have a stance of neutrality. So non-judgmental, willing to assure privacy and confidentiality. And you have to take note of this, of ABCs: support emerging autonomy, screen for risk behaviors, and assure confidentiality. So I mentioned kanina the format of visit. So this is ito na, parent and teenagers. Okay. Screen for risk-taking behaviors. So the form of words, because you have to have confidentiality because it increases the willingness of an adolescent to seek care. Okay, and then we have the limits when there is harm to self, harm to others, and when there is form of abuse. So this can be our form of words. Our conversation will be kept private, but I may have to share information if I believe that your safety is at risk. You hurt others, abuse, and other situations where your safety is at risk. These are the principles in approaching an adolescent. Be a professional, act as an advocate, and do active listening. You listen to the adolescent. Be mindful of nonverbal cues, especially if they'll be sharing mga private information. For example, if their sexual activity, so be careful of your expression, avoid stereotyping, explore the behavioral context as mentioned kanina, why they did this, why they cut classes, maybe they are being bullied in school, mga ganon. Okay? So we always start with non-threatening conversation. So this usually goes, we identify the strengths early. We look for examples of past difficulties that the patient has successfully overcome. Praise and praise is warranted. So you use open-ended questions like, for example, you say this, tell me more about it. Can you tell me what happened? Or introduce more sensitive questions with, for example, in drugs, you can use this introduction by ask all my patients these questions, or some of these questions may make you feel uncomfortable. Or you can also use this question, this technique. Many people your age have questions about smoking, or how about you, mga ganun. Or this one, third person approach. Have any students in your class or have any of your friends tried smoking? How about you? Have you? So I will be asking you questions on what would be the better opening line for each category. So I will start with home. Okay. An example here of a poor opening line is, do you get along with your mom and dad? Have you tried doing heads, or have you thought kung ano tuturuan na kamo about heads, or not yet? Yung home, education, were you taught already? Not yet?
It was discussed po daw.
Discussed by
An
who?
overview lang by Dr. Ramos.
Dr. Ramos. Okay, sige. Okay, so let's apply. Okay, so how do you go about, ano yung better opening line for home? Do you get along with your mom and dad? Ano kaya? What would be the better opening line for this category? Sige, go ahead.
How is your relationship with your mom and dad?
How is your, sige. So thank you, Noel. Who else? So, pwede din yan. O, pwede din yan. How is your relationship with your mom? That is if you establish that the patient already has both parents. What if the patient's parents are dead already or deceased, no? So the better opening line, kasi we cannot assume that the patient's parents are still alive or still together. So pwede, general, you ask, where do you live and who lives there with you? So no assumptions made, okay? Sino kasama mo sa bahay? Then you ask kung ma-mention, because usually, or some, di ba, their parents work abroad or OFWs, or they live with their extended family members, with their grandparents, okay? So, pwedeng opening line. So, pwede yan opening line. And then you can ask, for example, the patient lives with the parents, then you can ask that, ano yung sinabi mo kanina, Noel, na how is your relationship with your mom and dad? Pero the opening line that you can use is that this one first, no? Kasi you don't assume that the patient has his or her parents with them. The next, how about education? How are you doing in school? The usual response of the adolescent will be, okay lang. So what would be the opening line kaya? Better opening line for this category. How are you doing in school? Anyone? Parang parating nagsasagot si Yanni and si Noel. How about the rest of the class? I have 108 students. How about the rest? Ano kaya yung better opening line for this? Who wants to try? Are you all there pa? Ano kaya yung better opening line for this? How are you doing in school? Using the techniques that I mentioned kanina. Okay, sige. No one wants to answer. Sige. You can tell me about school, or what do you enjoy about school, or what do you dislike. Pero this is not applicable to our setting pala kasi some adolescents are working, di ba? They work for a living, they have to help their family. So, you can ask, ito, open, siya, closed-ended question, yes or no, are you in school? Pwede, or if the patient answers yes, then you can, ideally open-ended, pero some are not in school, education or employment, ito na category. So, you can ask, are you in school or are you working? The patient will answer. If the patient he is in school, then you ask the patient, what do you enjoy about school? Then what do you dislike? What is your favorite subject? You can ask further. Okay? For eating naman, what would be the better opening line? What do you eat? So the patient will answer, sige, pasta or adobo. So there's also an avenue where you can ask if the patient has body image issues. So you can ask, tell me what do you think about your weight and shape, okay? Or tell me about what you like and don't like about your body. Because from there, you can further ask if the patient has tried diets, or the patient has tried other medications. For example, if the patient is obese, wants to lose weight, the patient maybe has tried medication. So it's an opportunity for you to assess if the patient has eating disorders. Kaya you can ask this muna, yung view niya about her weight and shape. How about activities? What would be the better opening line? Do you have any activities outside school? Who wants to answer, man? I think you're right. Are you hungry, or are you hungry na? You want to eat dinner? 2 hours na ako, no? So it will be short lang. Sige. Okay. What do you and your friends like to do for fun? Ayan, pwede yan. It's open-ended. Next, do you use drugs? Using the technique that I mentioned kanina. Ano yun? Kung sinong nakaka-remember? The technique that I used kanina for asking about drugs. We have open-ended technique, generalized, normalized. We also have third person approach. Ano kaya yung better opening line for this? You can ask.
What
Sige.
drugs?
Sige.
Have you tried them with your friends?
Okay, pwede din. Have you tried? Or pwedeng, thank you, Charmaine, pwede din yun. Or, it, parang kasi you're asking the patient no, if pwede din, pero it would be better that ito this is applicable sa setting sa sa US. Pero you can ask or have any of your friends tried using drugs or alcohol before asking, how about you? Have you tried smoking or drinking? So you ask the first the friends and the the classmates or family members before asking directly the patient. Okay. Then sexuality, is it proper to ask this? Have you ever had sex as an opening line? Ano kaya yung better opening line for this, for sexuality? When I say sexuality, it's not just the act. What else?
About relationship.
Pwede. Have you had, are you in a romantic relationship? Pwede. Kasi hindi ka nag-assume na, for example, the patient is a female, hindi ka nag-assume that the patient is a boyfriend, no? Hindi ka nag-make ng assumption. So, okay. This is also ibang setup. Pero a setting sa US. Pero you can ask here, Sonji, or this is close-ended. How do you identify yourself? Do you identify yourself as male, female, or both? Who are you attracted to? Are you attracted to male, female, or both? Or have you been in a romantic relationships? And then from there you can ask. You can also, or you can already ask for other sexual activities of the patient. Okay. Or are you attracted to anyone currently? So hindi siya specific kung male or female, so it's non-judgmental. These are just some of the opening lines that you use when doing heads. Okay? It's already sige. In the interviews, do's and don'ts naman, kasi you can apply this when you have your clinics na, though it will be discussed later on. Should be open, do not be a parent, do not lecture, respect the adolescent's point of view, do not trivialize. Kahit yung concern of the adolescent is just the pimples, we have one patient na attempted suicide because of her pimples. She's an early adolescent kasi she has pimples. It may seem sa atin trivial, but for them, it's already a major problem. And then be a professional. Do not act like a teenager. Use clear and developmentally appropriate language. Do not use jargon. So do not use coitarch, monarchy, or mga STIs. Okay. So I already introduced these steps. You will go ahead with the heads na. Okay. So as mentioned kanina, when doing the psychosocial interview, these are opportunity for them to identify their strengths. Okay, so hindi lang mga problems or strengths or risk factors of the patient. So when you go ahead with your heads, you first ask for the strengths. Okay, so you ask non-threatening question first. That's why we start with home, kasi we start with non-threatening questions first, or categories, before asking about sensitive questions about sex and others and suicide. So kung home, you ask the protective factors. So always mention the protective factors first. Okay, who lives with the adolescent, to whom or he is closest to. Kasi an opportunity for you to identify kung sino yung adult that you can talk to if you identify that the adolescent has, for example, suicide attempts or high risk for suicide, for example. Or risk factors, if there is something, if there are issues that are bugging the patient in the household, for example, separation of the parents, or maybe death of a family member that could cause the patient to have other medical problems. Education or employment, so ito, what is the patient's aspiration or dream? Okay, before asking if the patient has ever had disciplinary issues in the school. To the protective factors, eating healthy food, preferences, or if the patient has body image issues. activities. The gadget use, you ask for the quality and the quantity. Risk factors for drugs. And if you identify that the patient has a risk factor, then you proceed with asking the craft interview. So kahit yung tool, so this is a screening tool to assess for substance use disorders. So there are corresponding questions for each. You have the craft for car, relax, alone, forget, family, friends, trouble. If the patient answers 2 or more to any of these categories, then you need to further assess if the patient has substance use disorder. Okay? So that's why very long talaga yung heads, no? Ay, yung heads. So if you identify that the patient has low risk, then there is a corresponding management for that. If high naman, if there is use in the past 12 months and craft score is more than 2, you provide information about risk of substance abuse. For sexuality, you can also ask here about body image or pwede din sa eating. And then the sexual orientation, gender identity, crush, boyfriend or girlfriend, then risk factors. So you ask if the patient has a history of being touched in a manner that made him or her feel uncomfortable, or where does the patient get information on about sex. And then suicide. So this is one of the major issues of adolescents today, depression and suicide. It's top 3. So you ask for these risk factors, history of suicide, of self-harm. Yung self-harm doesn't necessarily mean that the patient wants to die, pero it's already patient is already high risk for suicide kung may mga hesitation cuts na siya. So it would be better. So kahit yung concern nila is about abdominal pain or others lang, it would be better if you assess also for suicide and depression. So we have here yung sinabi ko kanina, yung Patient Health Questionnaire 9, which is a screening tool to assess if the patient has depression. And then, there are 9 categories here, 9 questions rather, 9 symptoms. And when you ask this to your patient, you indicate if the patient has had any of this for the past 2 weeks. So you qualify, I quantify na past 2 weeks. Tapos there's a scoring system for this, and then yung frequency, not at all, several days, more than half the days, and nearly all days. So these are the symptoms. If the patient answers more than 10 to any of this, then you proceed with asking for risk for suicide, okay? May screening tool for that. So even if you are not a pediatrician or not a psychiatrist, we can still use the screening tool, okay? This is being taught to all physicians now. Pero some are not comfortable using this. Pero if we identify, then we already help one adolescent, no? Okay, so if the patient score is less than 10, pero the patient score here is positive, ibig sabihin, either 1, 2, or 3, when you ask if the patient has thoughts that he would be better off dead or hurting himself in some way, then you proceed with asking for the risk for suicide. Okay? So ito yon. The score, if 1 to 4, minimal depression, 5 to 9, mild, 10 to 14, moderate, 15 to 19 is moderately severe, and 10 to 27 is really severe, okay? So when you add up all the scores, tapos then it's really high risk. High risk, you will further assess, okay? So ito naman yung screening tool for suicide, kanina for depression. Columbia Suicide Severity Rating Scale. So have ito low risk, the yellow color, low risk. Kung meron pa lang siyang thoughts about killing herself or killing oneself. Pero if patient has already started to think of methods and started out carrying the details, then it's already moderate risk. Pero if the patient has tried or tended to carry out this and has intentions in carrying out this plan, then it's already high risk. And then you will refer the patient to psychiatry. Okay? Or to the emergency room pala para makita ng psychiatrist. And last, ay second to the last na to, safety. Okay? You ask this, spirituality, it's not included in the heads, pero it would be better if you ask also kasi it's one of the protective factors for the patient. And then, so you wrap up, you ask for questions, concerns, or feedback from the adolescent, summarize and prioritize. So you talk to the adolescent first about the plans, and then you talk about the issues, and then before calling in the parents or the guardian, okay? And then always when you identify the strengths, you always need to praise the adolescent. Identify their strengths. Okay, so I think that's all. Thank you. Yeah, and you want to ask? Sorry, meron mga nagsagot na hindi ko na-answer. I'm sorry. Someone answered pala kanina sa mga questions. Di ko na what you usually do for fun. Ayan. Okay, so thank you. Do you have any questions? Wala na? Okay, so I would ask pala how many items are being asked? So I have a quiz after ba? When is your exam? Do we have an exam? May schedule naman. Okay. Okay, so thank you. May pa ba? May documentation? Do we have pictures? Okay, who will take the pictures? Si Ivan sa? Si Ivan?
Done na po, Doc.
When? Okay. Can I have one lang? I will just take a picture once lang for my own lang din. Okay. Sige. Okay, 1, 2, 3. Sige, thank you for one lang yun. Ilan ba? Okay, thank you very much. I hope you learned something today.
Thank you so much, Doc.
Thank
Good
you.
luck.
Thank you, Doc.
Thank you, Doc.
Thank you, Doc.
Thank you.
Thank you, Doc.
Thank you. I'll leave na. Salamat. And God bless.